singing in the dead of night. Take these broken wings and learn to fly all your life. You were only waiting for this moment to arise.
Hi everybody, welcome. We are on the road today with On the Spectrum. We are here at Easter Seals in Meriden, and I'm here with Carrie Alovnik. She's the physical therapist here at Easter Seals, and I've just been spending the last hour before we started shooting kind of getting to know everyone and looking at the place, and it's an amazing place. And thank you for being here with us.
You're welcome.
Or thank you for letting us be here. We came to you this time. So I think what we want to get at here is kind of, a lot of people have heard of Easter Seals. I've heard of Easter Seals and not really known what they do. It's not just a place where you fix your disability, physical disability, correct? I mean, I've been noticing when I've been speaking to you, it's much more deeper than that. Do you agree? I mean, I liked when you said, I'll just give you a basis for this. I liked when you said, when someone comes in, you're not going to just look at their knee problem. You're going to focus on...
A physical therapist is more apt to look at the person on a whole, because the knee problem may be caused because of an ankle problem, fallen arches where they need orthotics or something like that. So I personally will look at the joint above and below, and you also talk to the person. What are they doing? Are they a couch potato? Or are they somebody that wants to get back riding a bike 10, 20 miles a day, because if they don't, they get anxious. And you want to look at the whole person. And we do have a computer program. When a patient comes in, it asks specific questions on what they can and cannot do, so that even though then that helps us fill in the blanks. So it'll ask, can you walk 2 blocks? Yes. Can you walk a mile? No. How much difficulty? Can you clean your house? Can you reach a shelf up high? Can you stoop down and pick something off the floor? Because it's not just the pain and the limitation, it's the functional problem that we're dealing with, what they can and cannot do.
Yeah.
If I can get your function to improve and your pain maybe just modified a little bit, I've still made tremendous gains in your quality of life. If I can decrease the pain or get rid of it, then that's icing on the cake. But we want to continue to work with getting somebody more functional. And we deal with all ages and all types of problems. It can be orthopedic, it can be neurological, it can be cognitive.
Yeah.
So somebody is maybe dizzy and they lose their balance. There are some things that you can do to help them cope with the dizziness, different coping mechanisms, not stand up quick. I mean, if you jump up quick, sometimes your blood pressure drops. Okay, then let me take your blood pressure, see if your blood pressure is dropping.
Right.
And then we communicate that to the doctor. And here we do a lot with the orthopedics of all ages.
Okay. Now, we're here on behalf of ASRC, Autism Spectrum Resource Center. So my question is, how many people would you say, specifically younger ones, I guess, because I know you have programs for birth to age 3.
That's where we do more of the autism on the spectrum.
Right. How many people come in with simply, their knees hurting, their shoulders hurting, and then you guys find out there's an underlying problem of autism or of some other...
If they're an adult, I may not ever know that they're on the spectrum of autism, because an adult, they didn't have the resources that you have now. So they may have been coping with their autism their whole life and not realize it, and not realize what's going on.
And would you guys realize it? Would you, or is it kind of...
I may not realize it as much as maybe the occupational therapist might pick up on it more as an adult. But we will see the occasional autistic child who has an orthopedic problem. They were running, playing a sport, they tripped, they hurt their knee, they broke their elbow, they sprained their wrist, they broke a leg or something else, and they'll work with them. And children of all ages, whether they're on the spectrum or not, you have to make treatment fun. You can't just do 10 repetitions of exercise. You toss a ball with them to get their arms moving. You have them on the bike. A lot of the kids love our stair stepper because they feel they're an adult. And I mean, I've had kids that are they barely look over here and they're pumping on that thing. And it makes it fun. And you always end the treatment with a game or something else, because then they want to come back.
Okay.
If the child doesn't want to come back, you've lost your treatment.
Wow. How many kids and teens, not talking about adults right now, have autism? How many of them that you do physical therapy with have autism, would you say?
I wouldn't be able to answer that question because we
Okay.
don't have that data that
Okay.
would do that. The data that I would be getting is more the orthopedic, the physical therapy
Okay.
aspect that I'm treating. It's like asking me how many patients that I see that have a depression. I don't know.
Okay, so you're saying that's not really information widely shared because it
Right.
doesn't...
And it's not that pertinent to what I'm going to be doing
Okay.
with a child. I'm working with a child, and I'm working with an orthopedic problem, and I'll deal with the personality of the child. Some kids are very quiet, and I have to tone down how I treat them, because if I come on like a gangbuster, they get frightened, so I'll tone down. Or some kids like to play, so you be loud and you get boisterous, and then you start calming them down before they go home. If not, their parents don't like us very much.
What point in your career here, your career at Easter Seals, made you realize this is what you love doing? Because I sense that from you. You haven't said that flat out, but I can tell you love doing this. What moment here made you go kind of assure that this is for you?
Oh, that was way before here.
Way before here.
When I was in high school, the only thing that we knew about in medicine was doctors and nurses. So I had a science teacher that brought everybody, x-ray technicians, different therapists, audiologists, and everything else. And they happened to have brought somebody in from Gaylord, a physical therapist who showed a small film that was actually occupational therapy. But I came home from that day and I said, I'm going to be a physical therapist.
Wow.
And I never wavered from that, and I've never regretted it.
You obviously have a liking, though, for dealing with physical therapy with special needs, which is what this place specializes on, correct? I mean, you're dealing with people not just...
I like seeing somebody improve.
Okay.
When I improve somebody's quality of life, whether it's a 6-month-old or a 94-year-old,
Yeah.
I go home and I feel good. When you have somebody that accomplishes their goal, and that's how you end the week, your whole week is a good week. And that's what makes it nice. You know,
So you
somebody
love
comes
this.
in and says, oh, you know, I was able to walk with my daughter, and we walked a mile.
Yeah.
You know, and they haven't been able to walk for a while.
Yeah.
Or an older person that we finally got the right braces on, and they can start walking down the corridor. They may not be able to turn and sit down yet, but they are able to walk straight. Then we're working on the turning. Or a young child that can finally get up from the floor and get into their wheelchair. We've taught them how to get up, turn around, and sit down. Now mom doesn't have to pick them up and put them in the chair. That's a big accomplishment. And then the child is beaming because they're
Yeah.
independent, and I did it.
So this almost isn't work for you because you love what you do. I mean, that's what I get. I mean, I think Gandhi said it, if you do what you love as a job, you'll never work a day in your life. Do you feel that way?
Yeah.
I mean,
the only downside of this job is the paperwork. If all I had to do is deal
I've
with
heard
the
that.
patients, I would be very happy. But
I've heard that.
everything has a little blip to it, and it's the paperwork.
Yeah. You come in and then the other half's the paperwork, right?
Yeah, but to deal with the patients, oh no, that's not a chore.
Yeah.
Not
Yeah.
at all.
All right. Well, thank you for being here. Thank you
Thank
for
you.
meeting with us.